Hi, everybody. Thanks for tuning in today. Today we're here with Dr. Andrew Kirschner. He owns a solo practice in Ballackinwood, Pennsylvania. We're going to ask him a couple frequently asked questions about preventative care. So, Dr. Kirschner, to start, how do you define preventative care? What is that to you?
Well, preventive care is getting routine screenings that help you identify problems before they're problems. That's the short answer.
Yeah, that makes sense. And why is that important? Why should people do that?
Well, because with the different medications available and the things, the knowledge that we have about different common illnesses and common problems that people develop, there are a lot of things that you can do to prevent things from becoming really difficult. Years ago, if you had type 2 diabetes, your life was miserable. Right now, we can actually do things to control it. We know enough about the diet, we know enough about how to medicate, we know enough about lifestyle changes that somebody with type 2 diabetes can, have a very good quality of life, whereas 20 years ago, that wasn't the case. Um, Other things like heart disease, if you have a family history of heart disease, then you'll be more aware, you should be more aware of your nutritional components and things that you should be paying attention to, like cholesterol and triglycerides. Uh, because if you watch those and you keep them under control, you can control the amount of heart disease to a certain degree that you're going to have as you grow older. I mean, some of it's genetic, so you just have to do your best.
Yeah. And, as people grow older or maybe they have a lifestyle change, are their preventative care needs going to change over time?
Absolutely. Absolutely. The things that you worry about when you're younger are typically easier to manage and a lot less numerous. Younger people, basically, the main things you want to pay attention to are your overall weight, your BMI, paying attention to things like your cholesterol, because early on in the game, you can sort of control how much coronary artery disease you're likely to have as you get older. And you can do that through nutrition to a large extent. Again, not taking into account the genetic part, which you really can't do anything about. But as you get older, you have to worry about different cancer screenings and different things that can cause other problems. We look for prostate screenings in men. We follow up with mammographies in women and routine exams for all different things. In terms of easy preventive care, I recommend, testicular self-exams for men, breast self-exams for women, doing them once a month. Set an alarm on your phone and remind you to do it, because that can be helpful in terms of getting you on track with doing those things regularly. But there are simple things that you can do that can save you a lot of aggravation down the line.
Yeah. And so in determining what type of preventative care where they might have to see like a specialist or another doctor, should a patient talk to their primary care provider to get that sort of information?
Yeah, I mean, a lot of this stuff is just out there in the public domain at this point. Now, your primary care physician, when you go for your annual checkup, will ask you if you're doing a lot of these things. They're important to do, and they should talking about that during your annual exam should be part of the annual exam.
Well, thank you so much for taking the time to answer these questions today. And one last question, if somebody's interested in learning more about you or your practice, what's the best way for them to do so?
You can check out our website, which is linked in the video here, or you can contact my office manager, Turquoise, at the office at 610-617-9355.
Thanks so much. Bye.